Hi, I'm Dr. Jennifer Melaughlin, the Scar Lady. I am a doctor of physical therapy, and today I want to share an analogy with you about your core. So we're going to pretend that my ball here is your core and represents the intra-abdominal pressure management that we need. So we have your diaphragm coming from the top, your pelvic floor supporting from the bottom. We've got obliques wrapping around, internal, external. And then those most famous rectus abdominis, those 6 and 8 pack muscles in the front. And then on the back, we've got our back muscles. So lots of muscles that have to all play nice and work together to give us good central stability and breathing. And that way our head and our neck and our arms and our legs can work well off of a stable core. So if we don't manage pressure well and all the way around with all of the muscles playing nice and engaging well, sometimes that pressure gets a little bit different and altered. Oftentimes the diaphragm, if we hold our breath, what happens here? More pressure. So let's imagine that we have a surgery, and I'm going to use a rubber band to symbolize scar tissue. I put my rubber band around here. Okay. It popped off. But say that was a C-section. Y'all are getting this live. There we go. Okay, say this is scar tissue. If at the top, it might be from getting your gallbladder removed or having a breast surgery on either side. Or if it's the bottom, it might be scar tissue from having a C-section or a hysterectomy, or even having some tearing if you have a vaginal birth or having a episiotomy. So scar tissue can change the pull and the tug and the pressure management in our entire core and pelvic floor. They all get affected. And scar tissue changes the way your brain can communicate and find these muscles. It's like putting static in the line where the brain cannot recruit them and talk to them and say, hey, work like this the way that it used to. And scar tissue also clogs up our nervous system. And it's like wearing an invisible cloak of stress. And if we've had multiple traumatic things happen or multiple surgeries or procedures, invisible cloak, and that stress starts to layer and build. So it's hugely important to address scar tissue. If we can get it out of the way and say, hey brain, we need you to reconnect with your diaphragm. Let's find our relationship again with our breath and our pelvic floor, because they've got a pattern that they work in. Let's re-engage those obliques. Let's address, maybe an epidural has caused some fascial tension and tightening and pulling in the back. Let's address that so those back muscles can engage well. It all really matters to overall health and function of your entire body. Many times people will have shoulder or hip or knee or ankle issues, and the root is in the belly and the back from scar tissue. And we need lymph to flow well and the brain to have excellent communication with those muscles. So, hope you enjoy the analogy, and if you have any questions, please feel free to message me and check out our scar resources. I created online self-paced DIY classes where I teach you all about how scars affect your body, your brain, movement, and emotions, and how to help yourself, because if you change your scar, you just might change your life. Dr. Jen signing off.